So to paint this picture here, we've got an evolution of how medical care gets practiced to where now it's becoming more about production, more about hitting volume numbers. Physicians, there are in some cases shorthanded, they're feeling burned out, and they don't really feel like they have time to be empathetic, compassionate to patients, and there are some real financial impacts to missing out on that connection, right?
Absolutely. Absolutely. So anything we can do to help reinvigorate people, to remind them why they're there and to make their life easier is so important.
But is it one of the myths about correcting for this is that, look, I just don't have the time. It's just too, I've got to get these patients through. It's just, I just don't have the time. Is that a myth?
I think so, because if you're effective with your communication, you will be more efficient and you'll understand the differential diagnosis much faster, understand the complexity of the case much faster. And the patient will give you the information you need as well so it's going from a monologue to a dialogue.
Hmm.
You'll extract the information that you need. You'll also be able to convey the information that you have to give them, the instructions, in a much more efficient way, in a way that they can understand. And there are little tricks you can do it, and like things like teach back and art loops and things of that sort, which I'm happy to get into. So there are lots of little ways of doing that. And some people think, well, you have to have, that's a trait you should have. It's not something I can learn, but it's really something you can learn. I tell people if they can learn MR physics or organic chemistry, all those things you had to learn for medical school and radiology for my situation, you can certainly learn how to communicate with people more efficiently.